Magandang hapon po sa inyong lahat at maligayang bagong taon sa lahat ng nakatutok sa ating kapihan. Ako po si Nikki Nesasario, isang Juana mula sa Kagawaran ng Kalusugan at ako po ang inyong magiging tagapagpadaloy ng kapihan sa araw na ito. Bago ninyo makilala ang ating kasamang expert, narito muna ang ilan sa ating mga house rules. Next slide, please. To ensure the smooth flow of this session, everyone is encouraged to, number 1, use the naming convention below for Zoom usernames to ensure proper acknowledgement. Number 2, pay attention to the discussion of our health experts and resource persons. Number 3, keep microphones muted while speakers are discussing and presenting. Next slide, please. Number 4, should you have queries, participants shall signify and send questions in the Zoom's chat box and wait for the host to acknowledge them. There shall be an open forum after the discussion. Submitted questions will be addressed first by our experts, followed by the Zoom chat box questions. Every participant is advised to reserve questions. Again, nais po namin ipaalala na only questions related to the topic discussed will be entertained. So again, join the meeting until the last part of our session for today. Yan. So, di ko na rin po patatagalin pa. Makakasama natin ngayong hapong ito ang Director 4 ng Epidemiology Bureau ng Department of Health na si Director Althea de Guzman. Kanyang tatalakayin ang kasalukuyang Philippine COVID-19 trends and emerging diseases. Alam kong nagagalak na rin kayong marinig ang pagtalakay ng ating speaker at habang mainit-init pa ang inyong mga kape, no, sa ating hapong ito, narito na si Doc Thea. Doc Thea?
Thank you, Nikki, and again, thank you to our media partners. Happy New Year po. So for this afternoon, we'd like to be able to share not just some updates about our COVID-19 trends, focusing on recently reported variants and how it's impacting cases and admissions globally, but also other diseases that we have to actually take note of kasi these are emerging diseases that could also and would have negative impact sa bansa natin. So can we go on to the next slide? So like what I've mentioned, malaki ang naging focus natin sa COVID over the past 3 years, but in reality, ang dami nating ibang sakit na existing na even before COVID and even during the pandemic have gone on to be a public health threat both globally and locally. And in this slide, we're showing yung wild diseases natin. And alam naman natin, lumalabas sa mga bagong sakit. We had monkeypox in the last year, and we don't know, what they're calling a disease X could happen anytime in the future. And these are things that we need to be ready for. Next slide, please. And in our efforts, can we go on to the next slide, please? So in our efforts para makontrol itong mga public health threat na to, lalo na yung mga emerging at tinatawag nating re-emerging disease, ito pa rin yung ating major strategy, our 4-door strategy, where our doors 1 and 2 are supposed to, if not prevent, then at least minimize the risk of entry of these new or re-emerging public health threats. Our border protocols, while we have initially seen them as a way to zero out that risk na merong papasok na bagong sakit sa atin, nakikita natin na ang doors 1 and 2 ay actually nandyan siya para lang magkaroon tayo ng sapat na panahon para ihanda natin ang ating mga local health response para sa eventuality na makapasok siya dito sa bansa, kaya natin na mahanap siya at alam natin kung paano na siya i-manage at i-control. Andiyan ang door 3 para ma-ensure na namomonitor natin ang mga kaso, namomonitor natin ang admissions, at napapababa natin yung posibleng dami ng kaso, pagka-hospital at pagkamatay mula dito sa mga sakit na to. At alam natin at nakita natin sa COVID kung paano pwede ma-overwhelm ang ating public health system, especially our hospitals, kung masyado ng madami ang ating mga admissions. So, nandun palagi yung pagsisigurado na kung magkakaroon ng mga kaso at kung magkakaroon ng spike na mga kaso, hindi ma-overwhelm ang ating healthcare system. And when we talk about being overwhelmed, it's not just having enough beds and people to manage these diseases, pero yung hindi natin nakakalimutan na meron pa tayong ibang sakit na kailangan tuloy-tuloy, no? Yung mga serbisyo na ipoprovide natin sa kanila. Next slide. So ano ba yung mukha ng COVID natin ngayon globally? Globally, Omicron and its subvariants have actually become the prevalent sequence that has been submitted sa GIS-8, yung kung saan sinasubmit ng iba't ibang laboratorio at bansa ng kanilang whole genome sequencing. So makikita natin on the figure on the right that the green, halos lahat ng ito ay Omicron na at mga subvariants niya. In this year alone, various Omicron subvariants with higher transmissibility or more significant immune evasion capacity have actually emerged. And we are continuously monitoring it both at the global and the local levels. And based on sequence submission, meron tayong dalawa na subvariants ng Omicron na binabantayan dahil ang kanilang prevalence, yung pag tinotal natin lahat, yung kanilang contribution sa lahat ng mga na-sequence natin na samples, they accounted for more than 5% globally. So that's a lot, considering na ang dami ng subvariants ng Omicron. And these are namely the BQ.1.1, which accounts for almost 14%, and the BA2.75, and it accounts for just above 17%. So anong ibig sabihin na ganun kalaki yung contribution nila? Ibig sabihin continuously na nag-o-occur pa rin siya, hindi siya masyadong napapalitan ng mga bagong subvariants, at ito pa rin yung mas madalas nating nakikita na mga subvariants either globally and or locally. Next slide, please. In this next slide, pinapakita lang natin yung mga emerging, mga bago nating SARS-CoV variants na pina-flag natin. Sorry, you can go back to the slide prior. And these are being flagged again dahil sila ay mas transmissible or meron silang tinatawag nga nating enhanced na immune evasion capacity. Pero ang gusto nating klaruhin ay even though mas nagkukos siya ng mas maraming pagkakasakit, walang konkretong ebidensya na ang mga variants na to ay nagkukos ng more severe disease, or even more fatalities among our COVID-19 cases. Gusto rin nating klaruhin na itong mga bagong subvariants na to ay hindi na-classify ng WHO separately as a variant of concern or a variant of interest. So nakakabit pa rin siya sa Omicron, which is our most recent variant of concern. So kilala natin siya as a separate, may pangalan siya as BA275, BQ.1. At the end of the day, these are all called Omicron pa rin, At doon pa rin siya maiiwan na naka-classify as per guidance of the World Health Organization. Let's go on to the next slide. At dito, pinakikita natin na yung isa sa binabantayan nga natin, which is the XBB.1.5, which is anak, galing siya sa XBB na subvariant, ay yung mga nakita natin posibleng naging dahilan ng uptick ng mga kaso. In the graph on the left is in Singapore, nung nahanap siya noong October 22, ito ay sinundan ng mabilis na pagdami ng mga kaso sa Singapore. At nakikita din natin in the United States of America, ganun din. And right now, according to the reports of CDC, this subvariant is accounting for just about 27%, ng lahat ng mga nakita nilang kaso nitong unang linggo ng Enero in 2023, from just 2.3% noong end of November throughout December. So malaki yung biglang naging contribution ng subvariant na to sa lahat ng nakikita in the United States of America. Pero ang mapapansin naman natin, yung kanilang mga kaso is actually just the same or almost the same as in July, especially for the United States of America, and even for Singapore, no, doon sa graph on the left, even though there were upticks in cases, mas mababa actually yung dami ng mga kaso na nakita nitong end of the year to January in comparison to July, no, na madami talaga yung nakitang kaso sa Singapore, no? And it was also important to note na ang kanilang dami ng pagka-hospital ay hindi masyadong nagbago. So while there were more cases, hospitalizations were almost the same, no? Even with the appearance of or increased detection of this subvariant. Another caveat that I just like to put is, these subvariants are not the sole determinant of any increasing cases. No? Yan yung ating pinaaabot na maraming mga bagay na pwedeng naging dahilan kung bakit dumami ang kaso. We need to take note na tayo din naman ay mayroon ng pagluluwag, no, in terms not just of mobility but even some of the restrictions, no, mga mandates natin na posibleng nag-contribute din kung bakit nagkaroon ng mga pagtaas ng kaso sa mga lugar na ito. Next slide, please. So, ano yung posibleng impact, no, ng mga variants na ito sa ating bansa? Ito yung pinakabago nating mga projections, no, galing sa ating modeling partners, which is Autumn, at pinapakita pa rin niya na kung meron mang mga bagong variants, which are number one, it may be more transmissible and or immune evasive, posible pa rin talagang magkaroon tayo ng pagtaas, no, ng dami ng hospitalizations. And we're not just talking about the total hospital admissions, but even our ICU admissions. And we're showing here how it would look, no? Kung walang VOC, which is the dark green, kung more transmissible, which is the blue-green, at yung kung may immune escape capacity, which is the red. Pero ano yung gusto nating paabot? Number one, yes, it will lead to more hospitalizations and even ICU admissions. Pero kung titingnan natin, yung dami ng ating ICU admissions or hospital admissions will actually not even reach, no, yung nakita natin nung panahon na nagkaroon tayo ng peak ng Omicron last January to February of 2022. And we know that the number of hospitalizations during that Omicron peak was actually even less than what we saw with Delta. So it will not lead to more hospitalizations based on yung historical data natin. But of course, we don't want to set aside the possible negative impact. Gusto pa rin natin, ma-minimize natin yung potential impact niya on our health and critical care capacity. And that's where our vaccination, not just the primary series, but our boosters, no, will come in. And that will actually the ones that will play a big role in lessening or reducing these hospital and our ICU admissions. Next slide, please. So how does our current COVID-19 situation look? Currently, our ICU admissions and even our severe and critical admissions have slowed down, no, on a decline na siya. No? Meron tayong makikita natin na mayroon tayong konting uptick, but whatever uptick in hospitalizations we may see, these are actually not sustained as of now, no? Right. Also, ang ating total and ICU admission and utilization rates have remained at under 50%, or yung tinatawag nating low risk utilization rate lamang tayo. Pero ito yung sinasabi natin na when we talk about not being overwhelmed, we need to also look at our non-COVID data. So makikita natin sa graph ng right, while may konting pagtaas at pagbaba or even a continuous decline, no, sa ating COVID admissions depending on the time or on the season, ang ating non-COVID admissions have actually remained the same, no? After we opened up, after nagkaroon tayo ng pagbaba ng mga kaso nitong simula ng 2022, naiiwan na madami, no, ang paggamit or admissions natin because of non-COVID cases. So, and this is actually the ones eating up, no, more of our hospital beds. So, kaya napakahalaga na para hindi lalo pang mabigatan ang ating healthcare na capacity or ating health system, maiwang mababa, no, yung mga admissions natin because of COVID, because we know there are other conditions that we now need to address, no, given na 2 taon din tayong under a pandemic. Next slide, please. So what we'd like to summarize in terms of our COVID-19 transmission is SARS-CoV continues to evolve, no? Pero ang kanyang impact ay naiiwan na pagdami ng mga kaso. Hindi pa natin na-establish na ang mga bagong variants na to ay naging dahilan para mas malala ang pagkakasakit or dumami, no, ng higit sa nakikita natin ang ating mga fatalities. Napakahalaga ng ating ongoing vaccine deployment para sabi nga natin kahit na immune evasive yan, kahit na more transmissible yan, yung negative impact niya ay ma-minimize natin. No, we don't want to have more severe disease, especially among our vulnerable population. And we know that these are the ones who are older, with the ones with more existing comorbidities. At makikita natin na ano yung bago? Actually, sa ngayon, wala tayong nakikitang kailangan bagong gawin natin. Dahil ginagawa na natin ang dapat gawin. Napakahalaga ng surveillance. Ito ang nagsasabi kung kamusta na tayo. And when I talk about surveillance, hindi lang yung nandito sa loob. Napakahalaga, remember, our doors 1 and 2. And when I also talk about surveillance, it's not just looking for cases, but also being able to sequence enough. So we know kung ano yung variant profile natin. All of this data ay ginagamit natin para ma-ensure natin na sapat at napapanahon ng ating response. Hindi ko na kailangan paulit-ulitin yung halaga ng ating vaccine deployment. And of course, alam natin, no, there's still a number of uncertainties when it comes to COVID. So our local health systems will have to be always ready. No? Kaya kahit na nagkaroon ng upticks in cases in other countries, what we're telling them is we are ready. No? Ready siya na hindi lamang mounting a public health response of more active case finding, of testing, but also no, yung hospital natin, ang tao natin, ang healthcare workers natin ay handa at meron tayong sapat na gamit at gamot para i-address no, kung ano man yung magiging impact niya sa ating healthcare system. Okay. So that's for COVID. I will now go on to the next topic, which is about avian influenza. No? There has been some news about detections of human cases of avian influenza. Next slide, please. So for this slide, I'll not go over so much. We know what avian influenza is. No? It starts among our poultry. At pag sinabi natin poultry, no? Ducks natin, geese natin, even yung mga migratory birds natin. So it's not just about chickens, no, and domestic birds, no. At yung presentation kasi niya can really be asymptomatic. It can be mild to as bad as having severe disease, no. At meron tayong mga tinatawag na highly pathogenic or avian influenza or HPAI, no. At ito yung mga severe strains na nagko-cause, no, ng either severe disease among poultry or even fatalities, no, among poultry. And kasama dito yung isang strain which is H5N1, and it has been known to be deadly not just to our poultry but even to humans na who were infected, no, by this strain, no. Paano ba nakukuha ng tao ang avian influenza? Nakukuha natin siya dahil tayo ay na-expose, no, either by handling itong mga birds or poultry na to kasi inaalagaan siya, it's raised for business. Pero I'd like to, or even yung mga materials, no, yung waste materials nila, kasama yun, no, sa possible way na matransmit sa atin ng avian influenza. Gusto ko lang din ipaalala na, alam mo, may migratory birds tayo, no? So region 3 is this swamp na madaming migratory birds. So isang paalala din na, you know, catching and being exposed to these migratory birds can also be a reason, no, for us to contract avian influenza. Next slide, please. So, gusto din nating klaruhin na napakadalas kasing mabanggit ang influenza. So, avian influenza is just among the multiple kinds of influenza na nakikita natin. No? So meron tayo yung parang siguro mas familiar tayo na influenza, we call it the seasonal or common flu. Yan yung biglang dadami, posibleng dadami ang mga kaso, lalo na kapag yung panahon na malamig na. Example, in US, they're saying na itong biglang pagtaas din ng kaso over November and December is a combination not just of COVID, but actually, no, because of seasonal or common flu. There's also what we call, no, a pandemic flu. Actually, ito yung binabantayan natin palagi kasi ito yung ine-expect natin, not COVID, that will actually cause the next pandemic. No? So ibig sabihin, while influenza, the seasonal flu in itself is already highly contagious, this pandemic flu is even more contagious. No? And it will really be a person-to-person transmission. Next slide, please. So, punta tayo dun sa isang specific strain na sinabi nating highly pathogenic, no? At ito yung may mga nade-detect na kasi tayo na hindi lang niya naapektuhan ang mga poultry but even human cases. So, what we have here is data from the World Health Organization where we have already actually 868 human cases, no? But this is from the 2003, and the latest is until November 25. And this has been reported from 21 countries. And why are we flagging? As the data here implies, it has a case fatality rate of 53%. So 1 out of 2 people who will contract this strain will actually die. No? And more recently, there has been, the most recent report is from Ecuador, where their first, human case of avian influenza was actually detected. And right now, the hypothesis is this girl, this 9-year-old girl, was in contact with infected person. So hindi pa nila ma-determine kung ano yung specific na transmission. No? So gusto lang nating iklaro na kanina we're talking about common flu, avian flu, and pandemic flu. Hindi naka-classify pa ang H5N1 or other avian influenza as a pandemic. No? Remember, it will have to cause a large number of cases affecting multiple countries. So while it has affected multiple countries, the numbers are actually small. And the 868 is in a span of almost 20 years. No? So ganun kakaunti yung dami ng human cases na nakikita natin. So ibig sabihin, anong ibig sabihin nun? Hindi pa ganun ka-efficient yung animal to person na transmission ng avian influenza, and even more so, the person to person transmission of avian influenza is not yet efficient. And we're happy na hindi siya efficient, no? So, pero like we've learned from COVID, there's always the possibility that this could change. And it could mutate into something more transmissible, something na mas magaling na siyang mag-infect from animal to person or person to person, or even a more dangerous form, diba? Na pwedeng mag-cause ng even higher fatality rates or even more severe disease. Kaya napakahalaga na hindi lang binabantayan, pero we're doing something to control it. So next slide. So much like COVID, may phases, no, ang avian influenza. So dati ang Pilipinas ay nasa stage 1. Kasi ibig sabihin, among poultry and among humans, wala tayong any detected case. But we have already detected and we continue to detect, no, avian influenza among our poultry. Pero nasa stage 2 lang tayo kasi wala pa tayong ni isang confirmed human avian influenza case. And we want to be able to retain that status. At kung titingnan nyo, no, parang medyo mala door 1, door 2, door 3, and 4, no, yung stages of influenza din natin. At yung approach din natin is being able to control at the borders na, di ba, walang papasok dito sa atin, and that talks about not just monitoring people coming in, but even poultry products, no, na papasok dito sa Pilipinas, being able to ready our systems in case we do detect a human case, and then readying, no, not just human healthcare systems, but even, no, yung ating animal sector, kung magkakaroon talaga tayo ng big outbreaks, not just in poultry, but also in humans. Next slide, please. So, sa ngayon din, ito ay datos na available sa Bureau of Animal Industry as is the one conducting animal surveillance. Meron pa tayong 8 rehiyon, no, na ibig sabihin ongoing pa ang outbreak ng avian influenza. Sa ngayon, sa Ilocos Sur at North Cotabato, sila ay may mga kaso pa among native chickens and ducks, no, with 7 and 1 farmer, I'll clarify this, farms affected, no, not farmers, sorry, no. So ang pagdetect kasi natin ay mga poultry farms actually, no. Meron din tayo mga munisipyo mula sa Kamsur, Davao del Sur, and Bataan na from dati, no, meron tayong mga reported. Ngayon, sabi natin sarado na yung event, no, kasi wala na tayong additional detection of avian influenza in farms from these municipalities. Itong mga datos na ito ay nare-report, no, sa ating DOH Epidemiology Bureau, at tayo ay nagpo-coordinate with our animal sector partners so that hindi lamang ang Department of Agriculture ang nagre-respond, but also, no, the Department of Health and our local and regional counterparts. So ano ba yun? Let's go on to the next slide, which is pag tayo ay nakahanap at nakakuha tayo ng report, gusto ko rin ding iklaro na ang nire-report natin ay mga confirmed poultry outbreaks already, no? But there's also coordination na, health office, biglang ang daming nagkasakit sa poultry ko or ang daming namatay, no, dito sa poultry ko. Doon actually pwedeng nagsisimula yung coordination, no? And with that, nagkakaroon tayo ng pag-iimbestiga. So the provincial and local veterinary office conducts an investigation. And important is ma-determine nila ano ba yung dahilan, bakit namatay. Hindi lang naman kasi avian influenza ang cause of disease and fatalities among our poultry. Kasama doon yung pag-conduct ng disinfection, yung tinatawag nating culling, no, o yung pagpatay doon sa ating mga affected na poultry. But on the health side, napakahalaga yung pagbabantay, no, doon sa tinatawag nating close contact. Sino yun? Una, yung mga nagtrabaho sa poultry na yon. Ikalawa, yung mga nagkakal, no, at yung mga nagdi-disinfect, no. And we're also looking at the nearby community, no. If you remember, probably it was 5 years ago where we had this poultry outbreak in Region 3, we had like a 1 to 7 kilometer quarantine zone na bawal lumabas ang poultry product, bawal pumasok ang poultry product, at binabantayan natin, no, yung mga tao na nandoon sa area na yon, and of course, those in the farms. We quarantine these close contacts for 10 days. No? Yun yung known na incubation period kasi ng avian influenza. At yung mga nagkaroon ng sintomas, so again, this is flu. So magkakaroon ng fever, pwedeng mga respiratory signs and symptoms, yun ay tinetest natin. No? Pinapadala natin yan sa RITM para ma-confirm kung meron bang magpa-positive sa avian influenza. No? Sa ngayon, we're happy to note that while we have found symptomatic, no, we haven't found a suspect case of avian influenza. Pero merong iba siguro biglang nagbubo, nagsipon, o naglagnat, sila ay pinatest na rin natin, no? At lahat ng mga pinatest naman natin ay bumalik, no, na negatibo. Kaya sinasabi natin wala pa tayong any reported human case. So I'll end with our last slide. Next slide, please. Where we'd like to put across the message again that while a lot of focus has been put on COVID-19, kung may triple threat tayo ng communicable, non-communicable, and mental health, actually sa epidemics din, may triple threat tayo. We still have COVID, no? It's still not fully classified as an endemic disease because of a lot of evolution pa sa virus and a lot of unknowns pa. But don't forget what has been existing. Dengue, food and waterborne, we have our vaccine-preventable diseases. And we still face the threat of emerging diseases, mga bago at lumalabas at uli na mga sakit. Pero ang gusto nating ipaabot ay hindi tayo hindi handa, no? Kasi marami tayong layers of protection na available sa atin. At alam natin na epektibo para magkaroon ng higit na protection from all of these diseases, no? So we cannot overemphasize the value of our infection and prevention controls such as masking and adequate ventilation and hand washing. Vaccines will always play a critical role, and it's not just COVID. Remember, meron tayong threat from tigdas, from polio, diphtheria, pertussis, all of these vaccine-preventable diseases, kailangan sila din pinapaganda natin ang coverages natin. Napakahalaga ng DORS 1 and 2. Remember, these are among our first layers of protection. Alam ko, maraming na hassle kung mag-fill up ng e-arrival card, kung merong magtatanong kung symptomatic ka, pero alam nyo, napakahalagang bagay na ginagawa natin to. It's our contribution, no, to protecting our country from these threats. And siguro ito na yung napapanahon na mas palaganapin natin yung konsepto na it's a One Health approach. No? Hindi lamang to issue ng kalusugan, kailangan napakahalaga ng iba pang ahensya tulad ng Department of Agriculture, of DNR, because at the end of the day, these new diseases actually involve them also doing something to prevent their occurrence and us working together para hindi na nga lumaki, no, yung threats from this. So with that, thank you very much. That's the end of the presentation from DOH. Back to you, Nikki.
Maraming salamat, Doc Thea. Talagang siksik at napakaliglig sa impormasyon ng ating kapihan ngayong hapon. Talagang nabigyang diin ni Doc Thea ang mga hakbang na ginagawa ng ating gobyerno upang mapigilan ang pagkalat ng mga sakit, gayon din ang pagkontrol dito. Mabuti ring nabigyang linaw ni Doc Thea na wala tayong dapat ikabahala dahil under control ang COVID-19 cases dahil sa ating vaccine coverage at gayon ding handa ang ating healthcare systems, hindi lamang para sa COVID-19 kung hindi pati rin para sa iba pang mga sakit. So hindi na rin natin patatagalin pa, tutungo na rin po tayo sa ating Q&A portion at amin lamang pong paalala sa ating mga media partners na amin pong uunahin ng mga naunang magpadala ng kanilang mga questions at susunod po naming babasahin ang mga tanong na pinasa sa Zoom chat box. At paalala lamang din po, no, sa mga magtatanong pa lamang na maaaring mag-stick lamang po tayo sa topic na diniscuss ni Doc Thea kanina. So, Doc Thea, para po sa unang question, mula kay Mr. Emmanuel Vargas ng Super Radio DZBB, nadaragdagan pa ang confirmed cases due to Omicron subvariants. May need po bang ibalik ang mandatory use of face mask indoors to curb danger ng hawaan?
Okay. Yes, no? Tulad ng global data natin, yung mga nasi-sequence natin ay talagang mostly Omicron stella, no? It's either the original Omicron or these subvariants. And you know, that's expected kasi nga, ito yung prevalent or tawagan natin, predominant na variant globally. So it's also expected that will also be the predominant variant locally. I think it will be very unusual kung biglang Omicron siya globally, tapos sa bansa natin iba. Pero dun sa tanong na kailangan ba maging mandatory na, no, yung ating paggamit ng masking, no? Personally, no, I subscribe to that individual risk assessment, no? We know that it's a choice, no? It's your personal choice, but it's important that when you make the decision to whether you wear a mask or not, you're aware of the risk you pose on yourselves and to the people around you. So doon papasok yung, ano ba yung mga tamang tanong na itanong ko sa sarili ko. Pag ako ba nagmask, dapat ba magmask ako kasi may nararamdaman ako ngayon? Dapat ba magmask ako kasi may kasama ko sa bahay na symptomatic or na-expose ngayon? Or dapat ba magmask ako kasi ang mga kasama ko sa bahay ay mga matatanda na o may mga sakit na? So I think it's that ability to make those individual decisions na kailangan maging mindset na rin natin ngayon. Not just with masking na, but I think all other prevention measures.
Ayan. So thank you po for answering that question, Doc Thea. Para naman po sa susunod nating question mula kay Mr. Rafael Bosano ng ABS-CBN News. Have the genome sequencing results of the 8 Filipinos from China been released? Are there any new variants detected based on latest results?
Yes, no? So nagawa na yung sequencing, pero siguro yung inote natin, even though 8 yun na nag-positive on PCR, 4 lamang yung tinatawag natin na-assign tayo na lineage. So bakit hindi lahat may assigned na lineages, no? Minsan yung pagka-transport, na degrade, no, yung quality ng specimen, kaya hindi natin siya ma-sequence. So yung nakita natin, 3 doon ay lumabas na BF.7 at ang isa ay BA5.2. So ito yung mga hindi bagong variants. Dati na natin itong mga nadedetect, no? So kung unusual or unique? No. If we have already previously detected these variants that we have found, no, from these 8 positive individuals.
Thank you, Doc Thea. And for our next question po, again, tungkol pa rin po sa COVID variants. Mula kay Mads Villar ng Net25, despite the new COVID variants na patuloy na nakakapasok sa Pilipinas, patuloy ba rin ba nating nakikita na papunta na tayo sa endemic stage?
I'm very optimistic naman. I'm really hoping yes, no? But I think what we have been communicating is, and ito siguro, nahirap kasing ipin down kung anong ibig sabihin ng endemic, no? There's actually no standard definition of what endemic is. It's not just, kasi one reason is it's not just about epidemiological data, no? It also talks about ano ba yung meron na tayo, no? Sapat na ba rin yung kakayahan natin to actually detect, no? And to continually monitor. But ano yung mga senyales na posibleng patungo na tayo sa endemic stage? Number 1, kung titingnan nyo, no, yung ating epidemic curve, I think gusto nating i-level off, there will always be spikes, no, in our cases. Para na siyang season na mag-up and down tayo ng mga kaso. But in an endemic phase, unless, no, may something unusual happen, dapat wala na tayong big spikes. Much like we saw during the Alpha, Beta, Delta na variants of concern. So, yun yung isang big X, no? We also would like to say na tayo ay nasa endemic phase when not just case data, but even our hospital and mortality data is already stable. Wala na tayong big upswings or sustained upswings, no? But I guess the end of the day, the better question that we should pose ourselves is, hindi kung endemic na tayo, pero na-institutionalize na ba natin yung mga dapat na ginagawa natin in case mayroong pagbabago sa sakit. For me, that's what we should be preparing for. That's what we should be answering rather than kailan tayo magiging endemic phase or not.
Ayan. Thank you, Doc Thea. Sunod-sunod po yung tanong na tungkol dun sa mga COVID variants. Ayan. Doc, para po sa next question, is it possible that non-COVID-19 cases might soon outnumber the COVID-19 cases admissions with the current downward trend of confirmed cases?
I'll check, pero I think there are. Mas madami na talaga yung non-COVID cases natin. Pero alam nyo, expected naman talaga yun. Can you imagine pitting one disease against tens and hundreds of other diseases? So we really expect that there will be more non-COVID cases than our COVID cases because there are really more and because alam natin na ngayong nagbukas na tayo, naging oportunidad talaga siya, no, ng ating mga kababayan na makapagpatingin, makapagpagamot, makapagpa-procedure, makapagpa-surgery. At dahil ine-expect natin na dadami yon or maiiwang madami yon, ayaw natin dumagdag si COVID, no, doon sa burden sa ating healthcare system.
And Doc, we are down to our 2 last questions po, Doc. And for our second to the last question mula kay Mr. Rafael Bosano ng ABS-CBN News, based on DOH projections, the country may see 730 cases by mid-February, even if compliance to minimum public health standards decrease and new variants enter the country. Given the manageable situation of the COVID-19 now, is the DOH confident that we've reached the point that the emergency has waned and that the President is right in saying that we are no longer in an emergency?
It's difficult to answer, you know. I think that's one of the unknowns. Kaya din, even the WHO, never siyang magsasabi na done na yung emergency. But again, I think the way to go about it is, of course, we're optimistic. We hope na maiwan nga na ganito na lang karami ang ating mga kaso para then may better sense of confidence tayo in saying that, you know, we're really out of this emergency mode. Pero siguro yung gusto ko rin i-flip in a bit, no, doon sa pag-appreciate ng situation or not natin ay there's still a lot of focus on case data. But what the Department of Health is saying is that, you know, we should actually put more emphasis into looking into how much of our beds is actually being occupied by COVID, or how many or the proportion of cases that are actually becoming hospitalized or becoming deaths. Remember, in Omicron, we had the highest number of cases, but the number of hospitalizations are actually much lower than Delta. So sa atin, ang gusto nating i-measure, not just kung aakyat ang kaso, pero dadami ba ang na-hospital? Kasi at the end of the day, that will actually tell, no? That's the outcome that we really wanna measure. Kung na-burden ba yung healthcare system natin, kung madami ba tayo naging death. So yun lang, huwag nating kalimutan, kaso binabantayan, pero the bigger or the emphasis right now is reducing hospitalization, admission, and fatalities from COVID.
Yeah, thank you, Doc Thea. And for the last 2 questions, may ihahabol pa po tayong isa after nang babasahin ko. Doc, mula kay Red Mendoza ng The Manila Times, Doc Thea, do you agree with the observation of the World Health Organization that the emergency phase of COVID-19 will end this year? What would entail for the country to end its emergency phase of the pandemic?
Well, syempre we'd like sana. Pero I think much like the World Health Organization, it's really a monitoring it's a waiting game for all of us. Bakit ko sinasabi yun? We don't want to be blindsided by emergence of new variants. I think for me, that's the only unknown that remains here. Kasi patuloy siyang nagbabago eh. Parang 'di ba, every month may bago na namang variant. So if there will be some stability in the emergence of these variants, I think we would all be more comfortable to say that yes, the emergency phase will end, because while there may be upticks in cases, we know that there will be no significant upticks in our admissions and in our fatality. So, sorry, hindi ko masagot. We're hopeful that totoo at mangyari yung sinasabi ni WHO, but it doesn't fully depend on us, no? It depends on how this virus will change. But I'd also like to add that hindi naman tayo helpless, diba? Dahil alam natin na posibleng magbago na naman si SARS-CoV-2, dapat naghahanda tayo. Diyan pumapasok yung sinasabi natin, ngayon pa lang, let's level up our wall of immunity. Kasi hindi natin alam, baka magbago nga siya, mas maging higit pa siyang immune evasive, diba? Paano kung mas naging severe disease? So, dapat yun yung inaayos at ginagawa na natin ngayon. At ikalawa, naghahanda tayo. Hindi tayong parang, uy, nag-uptick na naman, ano kayong gagawin ko? So it's automatic, di ba? You know what to do next. You need to ready your LGUs. You need to have enough beds. You need to have enough logistics. You need to have enough HRH. No? So paghahanda siya to whatever unknowns, it's not being questioning palagi, ano pa ba yung dapat kong gawin? Or kaya ko pa ba? Or kaya ko bang i-manage ito?
Thank you, Doc Thea. And para po sa ating last question mula kay Mr. John Eric Mendoza, may we clarify po yung 8 regions na merong presence ng avian flu?
Sige. I think we'll provide. We're trying to check kasi yung nandun sa site ngayon, parang barely visible yung writing. We'll provide through our comms unit, no? Kung ano yung 8 regions na iba.
Okay. Thank you, Doc. And bago po tayo tuluyang maghiwa-hiwalay sa araw na ito, muli po, tinatawagan natin si Doc Thea para sa kanyang mga pabaong mensahe.
Pabaon. So, ang pabaon ay, I think we all celebrated New Year, no, happily. And you know, it's not just because of what government did or what the sectors did. I think it's also because of what we all did, no? Yung ating individual contributions, I think more than anything is the most important na kailangan matandaan natin at ituloy-tuloy natin. Siguro yung aking huling pabaon ay we survived, no? And we lived through the pandemic because of all of our contributions. We learned a lot of good lessons because of COVID-19. This is not the time to forget those lessons, no? So kanina, mahalaga yung value, naiintindihan natin ang value, ba't ako nagmamask? Mas naintindihan natin, dapat may adequate ventilation ako, no? Siguro baka ito yung dapat nag-mask ako kasi enclosed space siya. Napakahalaga po pala ng hand washing. Hindi pala dahil lang sa COVID kasi nagpe-prevent din siya ng respiratory illness, nagpe-prevent din siya ng diarrhea. I think yung second is Wag din natin, ito rin yung naging daan si COVID para magkaroon tayo ng better appreciation for existing services, and that includes vaccines. So I know COVID and even influenza was my topic, but again, part of the message is let's not forget other diseases. Vaccine is very critical, not just for COVID. We might be going out, getting out of the pandemic, but we have been flagging that we are at high risk for another outbreak of measles rubella, which has exited a polio outbreak. So I hope, and this is a call, to get ourselves vaccinated, not just for COVID, but also for other immune diseases, vaccine preventable diseases, so that sana makahinga tayo, di ba? Patapos na to, wag tayong pumunta sa isa na namang large scale at national outbreak. And I think the third is thank you always to our media partners. So you're our conduit for right information, for what our people will need to listen to, ano yung dapat na naririnig niya, dapat na naiintindihan niya para magkaroon tayo at may kapasidad tayo to make more evidence-based decision, and we can decide for ourselves, for our friends, for our families. That's all, and thank you very much again for the opportunity.
Muli maraming salamat po, Doc Thea, na talagang nakapagbahagi ng adequate and very insightful information tungkol sa ating paksa. Sigurado akong maraming napulot ang ating mga tagapanood tungkol sa kasalukuyang kalagayan ng COVID-19 trends, gayon din ng emerging diseases sa ating bansa. So muli nagpapasalamat din po kami sa ating mga media partners sa patuloy na pagiging katuwang sa pagpapakalap ng tama at napapanahong impormasyon pangkalusugan mula noon hanggang ngayon. So muli, nais ko lang din ulitin yung mga naging paalala ni Doc Thea na again, we continue to encourage everyone to employ our layers of protection. Hindi lamang ito proteksyon mula sa COVID-19, kung hindi pati sa ibang mga nakahahawang sakit. Mabuting maging self-aware po tayo para sa ating mga risk, hindi lamang para sa ating mga sarili, kung hindi pati para sa ating mga mahal sa buhay. At magsuot po tayo ng mga mask, mag-isolate kung may nararamdamang sintomas, maniguradong may magandang ventilasyon at higit sa lahat magpabakuna at magpa-booster po tayo para mas patuloy pa nating mapatibay ang ating wall of immunity against the virus. Muli, isang huwana mula sa Kagawaran ng Kalusugan. Ako po si Nikki Nesasario at magkita-kita po tayong muli sa susunod na Kapihan with Media. Maraming salamat po, Doc Thea.